This morning, taking a closer look at how COVID-19 is affecting our bodies long term. Doctors say people can experience symptoms for years after an infection.
New research on long COVID shows adults have a higher risk of developing brain disorders, and there are also new concerns for kids this morning. ABC Action News reporter Larissa Scott joins us live in Tampa with more on this. Larissa, this is troubling.
It sure is, Dia, and what a lot of that new data show is that millions of people now are being impacted by long COVID, and that it's quite common, even now affecting children.
As high as 1 in 4 people suffer long-term symptoms after resolving their COVID-19 infections.
Long COVID is when you experience any new, returning, or ongoing health problems for 4 weeks or more after a COVID-19 infection.
This even happens to people who have had mild infections.
The government estimates anywhere from 7.7 million people to 23 million people in the U.S. have developed long COVID. Since the COVID-19 virus can affect any part of your body, doctors say people can have all kinds of long COVID symptoms. Some of the most common are chronic fatigue, shortness of breath, heart palpitations, and body aches.
We have a lot of people who were athletes before and now can't have such serious pulmonary symptoms they can't even climb 2 or 3 flights of stairs.
According to a recent large-scale study out of the UK, adults who've had a COVID-19 infection have a higher risk of developing seizure disorders, brain fog, dementia, and other mental health conditions as a result of long COVID.
Millions of people may end up suffering long-term consequences as a result of this infection.
There's also new data about how children are being impacted by long COVID. That same study showed that children have a higher risk of developing epilepsy following an infection. A recent report from the CDC found kids who have long COVID are more at risk of getting serious lung, heart, kidney, and pancreatic problems. However, children seem to be less affected by long COVID than adults are. One study published last month estimates about 5 to 10% of children who've had a COVID-19 infection now have long COVID.
But still, 5% of all the kids in this country is a large number of kids, or worldwide even, that may end up having long-term problems associated with the COVID infection.
Experts predict long COVID numbers will climb as the virus continues to spread in our communities.
This is going to be a long-term thing that we're going to have to deal with as a public health problem for probably years or decades to come.
And the federal government says it's taking steps to fund more research so they can figure out how to help people with long COVID. Doctors say if you are experiencing any symptoms, to reach out to your personal physician. I'm live in Tampa this morning. Larissa Scott, ABC Action News.